and welcome to DeSera Clinical Education's Infectious Diseases Podcast. I'm your host, Dr. Karen Straube-West. Today's episode is the second of a three-part series featuring audio from a live symposium. We explore effective strategies to counter common myths and misconceptions about vaccines and ways to champion the benefits and safety of pediatric vaccines. In today's episode, I'm joined by Mary Koslap-Petraco, Patricia Stinchfield, and Jennifer M. Walsh. To view the full educational program, please visit the show notes for this episode. Now let's get started with Patricia Stinchfield.
I'm going to take us into some myths and mixed messages here on championing the benefits and safety of pediatric vaccines. And I want to just talk about this for a second. As I said, I worked in immunology at Children's for 35 years, ID in immunology, and I love talking to 6-year-olds about how their immune system works. Believe it or not, you can do that. Have them imagine the fighter guys and their immune system, the army that's there and always in the background, ready to fight disease. It's amazing. They get all excited about it.
Chewing up things.
That's right. Back when Pac-Man was good, that was common. I did use that one for sure. We are dating ourselves there, but so I think one of the things is that vaccines use up a tiny, tiny part of our immune system, less than 0.1%. It does not overwhelm the immune system, whether you give 1, 2, 4, 5 injections at the same visit. Your immune system's like, bring it on. I can handle it. Those newly licensed vaccines are tested alone and in combination with other vaccines. They're tested in animals first, then a small group of people, then a larger group of people, then the general population. So even when vaccines come out, they are not new. They've been around for a long, long time and being studied intensely. So I think it's important people know that vaccines do not weaken your immune system. They do not overwhelm your immune system. They protect children from vaccine preventable diseases. And like our colleague and friend Paul Offit describes the immune system like an ocean. So like if you're talking to a parent about MMR, measles, mumps, rubella, that's 3 antigens or 3 germs. We're going to try to build up antibodies, the good guys, the fighter guys. And if you imagine your child's immune system like that ocean and you want to put in a measles, a mumps, and a rubella antigen, it's like 3 spits in the ocean. It absolutely will not overwhelm it. So in combination vaccines, whether you give them individually or together, your immune system sees them as individual antigen. It's like a lock and key. It goes in as an antigen, it gets into that lock, turns it, becomes that antibody, and fits 1-to-1. So you're not going to have any changes, whether it's in combination or individually. And I think to that first question, that was actually a myth. When you look back at I think it's about antigens versus pokes. All right. So as we say in Minnesota, pokes. In 1980, there were fewer pokes for sure, but the number of antigens or those biological proteins that your immune system is recognizing and working with was about 3,000. Whereas in 2021, you can see the number of pokes has increased quite a bit, but the number of antigens has dropped substantially, thank you, science, down to around 320. So the protein chemistry, the purification, the recombination, the realizing we don't need necessarily whole cell for some things, we can use acellular vaccines. There's lots of reasons why we have more numbers of vaccines today, but less antigens. And I think it's really important. What is this? This number 72 kind of got in the misinformation, disinformation crew. And that's been going around with terrible looking memes of 72 needles poking in a child. That's getting at people's fear. And I do think it's getting at one of our biggest problems with immunization is pain. So whether it's a baby or an adolescent, you've got to have your distraction that's going on at the time of injection. So if it's an infant, they should be breastfeeding. If it's a toddler, they should be having bubbles or feathers that they're blowing. If it's a school-age kid, let them look at an iPad. If it's a teenager, put on their headphones and rock out. Whatever it is that they have some distraction to that pain, rub with a nice cold alcohol wipe really vigorously, and then their brain picks up pressure and not pain. All right, Mary Beth, I'm going to turn it over to you with this next myth.
Okay, thanks very much, Patsy. That was really a terrific explanation for that. Okay, so MMR vaccine does not cause autism. So this is going to be a bit of a history lesson for you. In 1998, this was the original theory. I'm old enough to remember this. It wasn't approved by any scientific board. He just went and did this, and and also always talk about the money. He was being paid money to do this by a group of parents whose children had autism, and he was also looking to discredit the currently licensed MMR vaccine because he was going to make his own. So then in 2004, 10 out of 13 co-authors pulled their names from the research study, and the Lancet published a retraction. But look how many years. And, like our good friend Dr. Paul Offit says, you cannot unring a bell. In 2010, Wakefield lost his license. I do not even ever refer to him as doctor. He doesn't deserve the title. So he can't practice medicine in England or practice here. And he was reprimanded by the British Medical Board. So they did this large-scale study in Denmark, and they had over 650,000 children, including those with risk factors for autism and siblings with autism. And they looked at their data. So what they saw was that the MMR vaccine did not increase the autism link and didn't trigger autism in those who are susceptible. They weren't even associated with an increased risk of autism. And now we have more studies coming out that say that there's a genetic link to autism and these developmental delays in children. We've also expanded the definition of autism. I'm a dinosaur. When I went to diploma school, children who had what we consider the classical features of autism, the stimmers, nonverbal, self-harm, that number of children with the classical autism has not increased. We've expanded the diagnosis, and those are some of the things we need to say as well. So we have repeated controlled population-based studies that show no link between autism and the vaccine. And like I said, I'm going to point to my own kids. My children got that old wholesale DTP, and the kind of thinking that you use behind that is that parents are saying, well, that caused my child to get autism or a developmental delay. What I'm going to say is, jeepers, that old wholesale autism must have made my kids really smart, because one has a PhD in quantum mechanics and the other one is a computer engineer who helps me make slides, by the way. So that must have been that old wholesale vaccine that did that. But that's the kind of thinking that these folks are using, and we need to explain that. So the Institute of Medicine has repeatedly reported there's no correlation between the thimerosal content in vaccines and in autism. And the cause of autism isn't known yet, but we're certainly getting more and more data that show that there is a genetic link there. We need to spend our money on other things, like to find those links, to help these children, to develop more interventions that can help these children. And the epidemiological studies in different parts of the world have shown the same thing. There's no relationship between vaccines and autism. And the vaccine safety data link also did not show a relationship between the vaccines and autism or any other neurodevelopmental disorders. So the take-home message here is there's a temporal association between things is not the same as causation. We start seeing features of autism right around when we're giving vaccines. But quite frankly, every child I have ever cared for with autism, I saw things when they were infants. I have it in my own family. Lack of eye contact, social smiles, those kinds of things show up very early. And it never failed me in all my years of practice that when that child went on to have autism, I saw features at 1 to 2 months of age.
And Mary Beth, can I add? I think, when I said the CDC is been changed, they did take down a statement on the
Thank you,
CDC
Patsy.
website. Yes, that said, vaccines do not cause autism, and listed all those great studies that you just mentioned. And because the Secretary of Health and Human Services has a personal mission to vilify vaccines, he made the CDC staff take that down. So it's no longer on their website, which is why, we are all encouraging people to use the NAPNAP website, use AAP for their vaccine guidance.
Thank you so much for remembering to bring that in, Patsy. Now, with that, I'm going to turn it back over to Jen for the next myth.
Thank you, Mary Beth. Excellent comments by my colleagues. So another myth is my children doesn't need this vaccine because this disease is mostly gone. So because vaccination has been so unbelievably successful in reducing and almost eliminating many of these diseases, it's made it difficult for the public to appreciate that, right? The public health has basically, with vaccination, created an invisible shield against disease. So we are needing to look at how can we make the invisible visible for our families. So perspective is really needed. Again, overwhelming number of parents vaccinate their kids. And the majority of American children, over 70%, follow that American Academy of Pediatrics vaccination schedule. However, we do know that that number of completely unvaccinated is rising. So in 2001, it was at 0.3%, rose to 0.9%, and then again in 2017, 1.3%. You might say, this doesn't look that impressive. This is very close, right? But when you think about the fact that out of 3.9 million children, this number went from about 10,000 to over 50,000 American children completely unvaccinated, right? And you think about how significant that number is when it comes to not just lowering or increasing their risk, but increasing everyone's risk when we think about herd immunity.
I think we also need to point out,
Yeah.
Jim, that this can be down. I mean, we always go down to the communities,
Mhm.
and this can be community. I mean, look at Patsy's community.
Oh,
It was the
yes.
Somali community. It wasn't the entire state. You know, here in New York, we have our Hasidic religious community who've been scared to death about the vaccines. So that's where these things start. So when we look at these numbers, they're very misleading, because if you go and look in those, I mean, you saw the numbers that Patsy brought up about how low the numbers were in her community. And I could show you the same thing in New York with how low the numbers are in some of our religious communities.
But I think that's a great point.
Mhm.
And it does tend to, it's the Mennonites in Texas, the Hasidic Jews in New York, the Somali Muslims, and it is not the religion. That is just what brings like-minded people together. They meet often, they're in close proximity, they spend a lot of time. So if a disease gets into a close community with low immunization rates, then it spreads within that community. So it's not what their religion is, because there aren't major religions that have any disagreement with vaccines. It's that
Right? No
like-minded,
religion is opposed to vaccinations. None of
right?
them.
Yeah,
Absolutely. Yeah, it's so important to remember that about the different pockets around where
right.
these numbers, we're concerned about in general, the entire US, but even more so with those pockets of higher percentages of unvaccinated individuals. Excellent point to remember. So, our cumulative measles report, we can see how this has been rising over time, particularly in the past couple of years. We've seen a huge spike. And we do have to think about, HHS and CDC and some of the information that came with that and how that impacted these numbers as well as the misinformation and disinformation that we have going on right now. But look at 2026. We are on record for an absolutely devastating year for measles in the US and getting close every year to losing that measles elimination status. So, and then we look at the percentage of reported measles cases in the US by vaccination status. And again, being a statistics kind of nerd, it's overwhelming about how at risk those unvaccinated or unknown are and how that is what's feeding the issue that we're having.
So let's just talk about a little bit about this elimination of diseases here. So there was a simulation model built with data from the U.S. Census Bureau and the National Center for Health predicting that declining vaccination could lead to millions of preventable infections. Well, we're there, people. 3 deaths from measles in the last year and a half, 2 in children, 1 in an unvaccinated adult who never sought care. Pertussis deaths across the country are increasing in young infants. And so we are seeing these diseases reemerge, and that parents and caregivers may not have that firsthand experience of the diseases, but that is where a wonderful new organization has started, grandparentsforvaccines.org. You can go there and you can join. You don't have to be a grandparent, but basically people like Mary Beth and I that remember having chickenpox, having influenza severely, I had hepatitis A. And so these stories are really important, that mix of the stories and the data that tells us that vaccines are safe and effective. We have to make sure that we're reaching people in lots of different ways, but we've got to get our vaccine rates up and keep them up. Every day there's a new cohort born we need to keep protecting. So vaccination is never over. We will have to maintain that herd immunity and protect the people who can't be vaccinated, including infants too young for the vaccines, the immunocompromised, people on chemotherapy, pregnant women. So I think there's a lot to debunking vaccine myths. There is misinformation about vaccines that has proliferated on social media. And if we could just get rid of the bots. There is so much misinformation and disinformation that is spread by not even humans, they're bots. And so we've got this misinformation online that we have got to be louder than. And going back to Jen's point, most kids who enter kindergarten are fully vaccinated. They may have spread out their vaccines, but they're fully vaccinated. We need that group of parents to be louder. And so if you've got parents in your clinics that want to participate, we're going to give you a slide in the end that there's some organizations that they can join and get their voices out there. But making sure that we're using evidence-based strategies and trying to really get at those biases and misperceptions and misinformation. And so building trust is really the most important thing. And trust is earned. Trust doesn't happen in one visit. Trust doesn't happen because of the initials behind your name. Trust happens because you have spent time with them. And I always tell people, clinicians, to think of that Venn diagram. The one circle is you, the other circle is the parent. What is the part that overlaps? And really, it's mostly safety. You want their child to be safe. They want their child to be safe. It's just that you are approaching it differently. You want them to not get vaccine preventable diseases. They want to not have anything harmful from vaccines happening. And so that's the part that you work on together. But we know that we can be those trusted voices. We are the influencers. And I think the best thing is to never give up. Like if they say, I'm not doing that chickenpox shot, chickenpox, it's such a cute name. It can't be a bad disease. It is a terrible disease. It can get into people's brains. I've seen patients that have lost limbs because of staph infection. And so, yes, it's a very serious disease. It's one I saw a lot in my early career. And if you don't want to vaccinate today, let's talk about it next time. Here's some things between now and then to read. The conversation should continue. And then they're like, wow, she really cares. She really is saying the same thing every time. That trust gets built up over time. Your credibility, your knowledge, your concern, your compassion, your listening. And nurses, as we know, are the most trusted of all professions. And we need to continue to use our power in those conversations. So building trust with parents and caregivers, again, establishing that safe relationship, understanding where they're coming from. We might just assume they think that MMR causes autism, and that's not on their mind at all. They might have had a relative who had a severe reaction. And is this going to happen? It happened to my cousin. Is it going to happen to me and my kids? Offer that information to build their knowledge. And again, it's sort of the statistics and the stories combination that's really important, and trying to clarify and accept where they're coming from and give those relationships time. So who and how to debunk those vaccines. The key takeaways are, again, use your trusted providers in healthcare, making sure that we're having facts alongside both what the long-term effects, what side effects may be, And what to expect, I think one of the most important things that we as clinicians can do is say, I'm giving you your MMR today. I want you to take out your calendar and in about 10 to 14 days, put a little dot on there for rash, and write it down because this is a live vaccine. It may cause a little mini version of measles that gives you a rash. It's not contagious. It's not going to be harmful, but they may develop a fever and they even can have a rash with it. And so when that happens, it means the child's immune system has recognized this vaccine. It's seen it. It's building antibodies. And that's exactly what we expect. We expect some fever because that's your immune system's first response. We expect some redness. That's the inflammation and swelling. That's the immune system doing its job. So when those things happen, they aren't afraid. They aren't like, oh, I'm never going to vaccinate again. They're like, oh, here's what they told me was going to happen. They think you're genius. So making sure that you describe and detail what they should expect for the next day. They're going to be sleepier. They're not going to eat as much. And so when those things happen, it's not that something bad happened. It's that their immune system is really working hard for their child. That's a good thing. So that effectiveness in debunking can fade over time. So as I said, you're never done with immunizations by age. You're never done with them by visit. Every visit is a vaccine visit. Those conversations, if they come in with a broken thumb, you fix their thumb and you look at their immunization record and you make sure that they get caught up. So continual efforts are always required.
Thank you, Mary, Patricia, and Jennifer, and many thanks to you, our listeners, for joining us. To view the full program and download the accompanying slides, please click the link in the show notes. To get access to all of our new podcasts, subscribe to the DESERA Clinical Education Podcast on Apple Podcasts, Google Podcasts, or Spotify. Thank you, and have a great day.